Well, we are here today to talk about a topic that is increasingly important and increasingly an issue for you as you try to conduct business in this challenging environment. The numbers are pretty staggering. We expect national health care spending to reach about $2.5 trillion this year. It's going to be about 17.6% of the gross domestic product. So the numbers alone certainly grab our attention, and the experience that we have in terms of trying to provide coverage for employees and trying to manage the very devastating health experiences of some of our employees who may not have insurance certainly shapes a lot of our days. There's no question about that. And this is a great panel who can really speak to this issue from the ground level. They can tell you what it's like here in Hampton Roads to deliver health care in this increasingly complex economic environment.
Employers purchase 54% of the health care through group plans in this country. They want to see quality, and they want to see health improvement. They want to see a focus on wellness, prevention, screening, health promotion, etc. We know that only 55% of adults receive the recommended care when they go to their doctor. We know that 30% of what's called overuse, and that there's waste in the system and inefficiency in the system. So we are totally interested in consumers becoming more engaged and being aware of what they're buying.
From my perspective, being a private business owner, I've been in business for 10 years now. I'm a classic example of ever-increasing healthcare costs, and especially the last 10 years. Right now, I'm approaching 10% of my budget for healthcare costs. Now think about that. That's approaching more than what my rent is for a 10,000-foot office building. I have 32 associates, so it's a real line item for me. And it's getting to the point of being unbearable. The biggest issue right now for us is smoking, cholesterol, and blood pressure. And it's a direct relationship to the overall cost. Well, what's going to happen is these costs keep on climbing, and if in fact some of the associates don't take care of themselves, right now I pay for the individual associates' premiums. Well, if I've got somebody that's obese or overweight, high cholesterol, high blood pressure, I'm going to start asking them to contribute to that premium. That's my next step if, in fact, these costs keep on increasing.
I'm a firm believer in that patients also need to have a stake in their own health care. Because we have such a high obesity rate, I think it's upwards of 2/3 of the American population right now overweight. They have hypertension, they have diabetes, they have high cholesterol, they got vascular disease. I mean, you name it, they have severe arthritis, and there's no accountability to those patients to be healthier. I mean, why should you, if you're healthy, supplement somebody else who's markedly overweight for their premiums because of the way the system is currently set up?
For those who are at risk and disadvantaged, then we have a moral responsibility to look at incentives and to look at subsidies that can help to support that process. If you visit our website, you'll see the research that we've done state by state, confirming that today 20% of all school children have at least one chronic condition that if mom and dad lost their insurance, had to move into a new policy and be subject to pre-X, these children would not be covered for that condition. We must eliminate the annual caps on services, and we must eliminate the lifetime caps. We have a family here in Virginia Beach who came to visit us. They have an 8-year-old son that's been battling leukemia since the age of 2. Mom and dad are both executives, and both have changed careers twice simply to move to new health insurance coverage that would provide broader caps at a lifetime, because this little fella was already crashing through a $2 million cap.
EMTALA is the Emergency Medical Treatment and Active Labor Act. It's a law that says anyone who presents to an emergency department has to be given a medical screening exam to see if they have an emergency medical condition. If they have that condition, they have to have stabilizing care. We can't ask insurance information, any demographic information, payer mix, payer class, any of that stuff. If they need it, they get it. From my perspective, being able to provide that care is an honor. From their perspective, it's a financial crisis as well as a medical crisis. From the business standpoint, when I'm not wearing my hat as an ER doctor, I serve as the chair of the Riverside Medical Group, and we are trying to provide integrated care with an electronic health record, and we're trying to access the funds through the stimulus package so that we can afford $100 million worth of technology to integrate these health records, to integrate the outpatient health record with the inpatient health record.
What we're focused on, from an insurance standpoint, is really how to bend the curve. And you're going to see that there's a lot of consensus, at least in the national healthcare reform packages that are out there, that we need to be able to bend the curve to be able to pay for all this. I think all insurance companies will tell you that they're in favor of some type of reform. Some people would like to make this a revolution, and some people would like to make it an evolution. And we've got to be very methodical about how we do this, because it affects every person, not only in this country, but it will affect it in the world.